I'm Samantha Anderson, Director of Communications for Newton Public Schools, and I'm here with Superintendent Man Rankin, and we're here to just go over really quickly some of the highlights from last night's Board of Education meeting, as well as answer any questions you may have. As always, if you do have questions, feel free to leave them in the comments section, and we'll get to them as soon as we can. Okay, to start off, the board decided to extend the gating criteria. Could you just let us know the thought process of that and what all goes into that?
Well, we're trying to, if you remember from the special meeting we had last week, we're going to go 2 weeks at a time. So the decision was made to extend an additional week, which would put us from the October 12th through the 16th week in the green mode based upon the numbers that we got off of the Harvey County site, off of our attendance data, and also off of the Kansas Department of Health and Environment site. It just allows you as parents to be able to plan a lot more further out than a week at a time. We know that was causing some stress. So when we look at our numbers, our trend is slightly up in terms of the 2-week disease spread. We look at our percent positive, though. That's actually floating downward a little bit. We're at 3.11% for the 2-week period, which is great. So when you look at the total number of cases over the course of the last couple of weeks, we're looking at like 32 cases, which is good. On attendance data, we're within the staff attendance range. The normal attendance rate's about 10.87% for teachers. This week we were at 11%, which we're still around that normal range. Our student data, we're right about where we normally would be for the 3-year average at 94.5% if you round to that decimal. So when we look at the overall status for the 3 criteria, we have 2 greens and either a yellow or orange, depending upon how we want to consider that disease spread trend. And with the case numbers being pretty low, even though the trend is slightly upward, the decision was essentially made to consider that a yellow, so that would put us in the green. We look at the other 2 criteria that can be used, which is the 2-week cumulative incidence rate. We're at the 93.8, around 94. When you look at that 32 cases over the 3,400 or 34,000 individuals, which would get us about 94 per 100,000, which that puts us at a yellow. And then the hospital referring capacity is at a green. So we've got 2 yellow and 3 green when you consider 5 criteria. So one of the things we want to make real clear, though, is if something were to really get out of whack and we were to jump a couple of levels between now and next week, if the need would arise to revisit, then we would do so. But right now we're comfortable with numbers, the way things are. Folks, keep wearing your masks, keep social distancing to the best of your ability, practicing the good hygiene, washing your hands, and so on and so forth, so that we can keep doing the things we're doing, keep playing sports, keep having all the activities and things of that nature.
All right, and just a reminder, if you have any questions, leave them in the comments.
Is that me or you?
It is me. I have to do that once a live stream.
Okay.
And just a reminder, as I was saying, if you have any questions, feel free to leave them in the comments section. And then going on to the operations and instructional plans for COVID, we had a couple of changes we made on both sides. Can you just go over those real quick?
Yeah. These changes are made based upon when the administrative group gets together, and the administrative group consists of all the building principals and most of my district office directors. We meet twice a month, and so at each one of those meetings we're going to spend a little time kind of revisiting some of the operations and instructional processes. And at the last one that we met this past week, a decision was made by that group collectively through a lot of discussion with respect to masks for outdoor recess. No masks are going to be required when they're physically exerting themselves. And they're going to also be encouraging social distancing in those environments. That's really one of those things when the kids are outside, if they are exerting themselves, one of the things we have with the littles, especially when they're coming in after recess, they've had those masks on. They're doing a great job of wearing those masks, but they have those masks and they're all hot, sweaty, and those masks are kind of dripping wet. It's a lot harder to breathe through those things when it's like that. So that's one of the recommendations that came from the field. And the same thing with physical education when they are physically exerting themselves. We're doing that already, like with our athletes and things of that nature. So they've essentially extended that down through those environments with PE and outdoor recess with physical exertion. With birthday treats, our wording was essentially they had to have prepackaged and store-bought individually wrapped items. So each individual thing, instead of taking in a box of cookies, for example, we wouldn't allow that before. You had to have each one of the individual cookies wrapped. So essentially what we're saying, you can bring in prepackaged but more bulk type of items, and then they would be distributed to kids using good hygiene practices, wearing gloves and things of that nature. So those were the two things in our operations that were adapted this past week. For instruction, for right now, we're going to keep our K-4 library the same in terms of all of those services are being provided from a Christian perspective. Grades 5 and 6, those students are going to be allowed to bring students to the library for checkout only. The actual library instruction won't take place in the classroom. We also had some discussion about remote students and testing. This deals mainly with the fast bridge testing, about being able to work with individual students, and if a parent wants to bring their kids into campus for that testing, we want to be able to allow that flexibility. So those were essentially the 4 changes that were made in our operations and instructional plans.
Okay, and then we've had a couple questions. Some people were wondering, as far as communication goes, if there is a positive case in the school, what will the district do?
Well, the district is going to send a letter out from the building in which that positive case was reported. We've had 2 positive cases reported within the last week, all right? And so wherever that case is reported, that letter will be sent to those parents in the building that the case was reported. I think I already said that once. So one of the things that we have to be really careful about is protecting the identities. We have to follow FERPA and HIPAA as it relates to the medical part with the HIPAA and the FERPA part with the educational piece. So we have to protect the identities of the individuals. And so that letter will be sent. We then communicate with the Harvey County Health Department, or they will have communicated with us about contact tracing. We have a lot of processes in place in terms of we're trying to keep those groups of students together. We have seating charts on buses. In lunchrooms, there's an accountability piece in terms of where kids are sitting, so we know where kids are and who they're associating with. And so our staff, our nursing staff, works with, and our principals work with the Harvey County Health Department to go through that contact tracing piece. So if you're considered a close contact and need to quarantine, the Harvey County Health Department will reach out to you in that case. So that's the process that we worked out with the Harvey County Health Department, and it seems to be working all right. I mean, right now, in terms of numbers, we've got about 29 kids as of today, actually, 29 students that are under quarantine, and we have, I believe it is, I'm trying to pull this up here, 4 staff members that are under quarantine. Okay, so I produce those numbers each week for my staff in weekly notes, and we'll keep communicating, like I said, with you if there is a case in the building. Now, we've been real lucky compared to some other schools, and we've not had a lot of cases. We may have to make some changes as we proceed. If we have like 20 cases in a day, we won't send you 20 different letters. There'll just be a notification, and we'll make changes if we need to in terms of that. If it becomes like, okay, yeah, another case, we don't want to overwhelm you with all that stuff. So we're going to continue to monitor symptoms of students and staff. We'll send students and staff home if they exhibit at least 2 of the symptoms that are on the charts, which are fever, the cough, the new loss of taste or smell, chills, muscle aches, headache, sore throat, congestion or runny nose, nausea, vomiting, diarrhea without an alternate or more likely diagnosis. So there's a lot of different things that we have in place, and Nurse Lehman and her staff have done a great job of working with the Harvey County Health Department to come up with all these protocols. So we're very comfortable and confident in those processes. But we will not put anything out that will be personally identifiable in terms of information about an infected person or student or staff. We won't do that. So.
Okay, and last but not least, unless
Can't hear you again, Sam. It's okay.
last but not least, if we do get more questions, we'll ask them. But otherwise, tomorrow's lunch pickup for remote students. Can you just remind them where it is and when it is?
3:30 to 5 p.m. tomorrow up at the high school, up at Newton High School. Remote students only. Remote students only. Because remember, we're in full 100% attendance. So the kids in hybrid, there are no hybrid students right now. They're all remote.
All right, great. Well, that's all the questions we have. So if anybody watches this and maybe has other questions, feel free to email info@usd373.org, and we'll answer them as quickly as possible. Thank you so much, Mr. Van Raken, for being here.
Have a great evening.